My name is Rachel, and I'm a speech pathologist that travels between long-term care centers and small hospitals in rural western Iowa. And I am horrified by what this federal healthcare bill is going to do to my patient base. When you gut $500 billion from Medicare, I know exactly who it's going to affect. It's going to affect those people with long-term Parkinson's disease, long-term dementia, that the ones that President Obama said, just take the pain pill in his healthcare forums. I would like to see him choose between having the ability to communicate with his family and his friends or taking the pill for his pain. There's such a direct impact on quality of care. It's just horrifying. And then I'm also Generation Iowa Commissioner. And I was involved with Generation Iowa Commissioner from the start because I already see the effect a shortage of qualified healthcare professionals has on the quality of services and care that people receive. I see it every day because we are already in that situation in Western Iowa, especially the rural areas. And when you're looking at reducing healthcare reimbursement from Medicare, and if we, God forbid, get to that public option, which Medicare already pays less than everybody else in private insurance, then and the cost of what it takes to become a healthcare practitioner now, who do you suppose is going to be left to serve not only Western Iowa, but the general population? It petrifies me to think about having to wait for a week, 2 weeks to be able to get in and have my child taken care of, or that not being able to get the testing that I need done for one of my patients. I was in Chicago a number of years ago for a continuing education class, and there was 2 speech pathologists there from Canada, and we were talking about using a standard test. It's kind of an X-ray swallowing test that we use on a routine basis. And they were just in shock and finally asked, how long does it take for you guys to get one of those? And we said, within a week, within a couple days, depending on the schedule of radiology and the radiologist and therapist. And they were just aghast because it was taking them 2 months, and they were only reserved for the worst of the worst, which in many cases you already know what it's going to be. They're going to do poorly. So, and then the irony is my husband's also a healthcare provider, and he had 15 Canadians in his optometry school class. And of those 15, only 1 went back to practice in Canada's socialized medicine because of the limits on their ability to provide care, and then also what they were going to be getting paid. They couldn't afford to go back to Canada because of the cost of their education to get to be the provider that they wanted to be. And I'm so fearful that that's where we're going to end up.